I'm Nancy Walsh for MedPage Today. At the annual meeting of the International Lyme and Associated Diseases Society, or ILADS, we spoke to some physicians who specialize in treating patients with Lyme disease, and particularly patients who just don't get better with standard therapy. Dr. Robert Bransfield, the Society's president, explained what ILADS has done for doctors who struggle with difficult cases of the disease.
ILADS has been in existence for 11 years now, and we originally organized as a group of clinicians where we found we had common interest in treating Lyme patients, dealing with common issues. It gave us a lot of support, colleague sharing information, and it helped us to collaborate, work along the same lines with coordinated research and educational programs, and it's been very useful. Many of us independently were discovering some of the same things, and by having a professional organization, it helped us to better average things out so that we could see where some of us might have been extreme or where we were on the same track and not going up blind alleys, but we're on a track with an emerging disease that we don't understand. The science is unsettled, and we need to recognize that's the way it is.
Dr. Bernard Raxlin, who has a full-time practice in New York City devoted exclusively to Lyme disease, said the organization has also been helpful for patients.
Well, I think they can see that there's another story, and it gives them also access to scientific credibility and to other patients' own stories, and just the fact that it's a nationwide organization with multi-specialties involved rather than, say, one subspecialty like infectious disease. You know, we have everything from neurology to pediatrics to psychiatry, internal medicine, rheumatology, ENT. So that's pretty formidable, all looking at this problem from different points of view and bringing that information together.
These doctors advocate using unconventional approaches, including long-term antibiotics, which has brought them under fire from mainstream medical societies such as the Infectious Disease Society of America. The Society's past president, Dr. Daniel Cameron, offered a defense of their approach.
Well, I think there's always a dialogue that takes place. The idea is, as often said, that there's nothing like chronic Lyme disease, that everybody gets better. It's nothing more than aches and pains of daily living, and that's great when someone's better. But if someone's still sick, then we say, well, listen, we have something to offer. There's plenty of evidence that says that we should treat further, or we should look for a co-infection, some other bacteria, and we've done great with these tough cases.
Dr. Bransfield also explained that his organization tries to involve multiple specialties to better address the multifaceted clinical challenges involved in Lyme disease.
It's also useful that it's a multidisciplinary approach because there's a very broad spectrum of disease presentations, and having doctors from different specialties allows us to incorporate observations from psychiatry, neurology, rheumatology, and bring it all together, and that's been very helpful.
For MedPage Today, I'm Nancy Walsh.